Okay. All right. Okay, I'm going to call to order this meeting of the Assembly Housing and Homeless Committee. It is Wednesday, October 16th at 11:01. Let's start, if we can, with just introducing members that are here first. You want to start, Mark?
And Mark Littlefield.
Karen Bronga.
Cameron Perez Verdia. And then on the phone, we have Member Martinez.
Yes, thank you.
And Ms. Brawley.
Yes, I'm here.
And then Mr. Rivera.
Present.
Okay. And then we also have a full house of guests. So we'll go ahead and get started. And then it looks like Mr. Constant, you're on as well. Is that correct?
Yes.
Okay, great. All right. As usual, if those on the phone need to get into the queue, please just send me a text. My cell phone is fully charged this time, so I'm ready to go. And I think we'll get started. We're going to start. We have a pretty full of agenda, but I think there'll still be time at the end for us to make sure we have time for public comment. So let's start with the Anchored Home Strategy Plan. I think it sounds like we have two people from the coalition here. If you want to introduce yourself for the record, and then go ahead and do your update. Thanks.
Yep, Meg Zalatel, Executive Director, Anchorage Coalition and Homelessness.
And Jessica Parks, Chief Operating Officer, Anchorage Coalition and Homeless.
Great, thanks.
All right. We're going to take your data points a little bit holistically because it all works together. So the first thing we want to talk about was the Project Homeless Connect, which happened yesterday at the library. We were happy to see Member Bronga, Member Perez Verdia, amongst many others volunteering. So I have a little bit of off-the-cuff data for you in terms of service. We served between 400 and 450 individuals at Project Homeless Connect yesterday, and we conducted 305 coordinated entry assessments. 47 of those were new, so new to the system. So we were really connecting with a lot of people who are already experiencing homelessness, but 47 brand new first touches to the system, which is a really big part of why we hold that event. Couple of things I want to highlight from that event is why we do it. We do an annual Project Homeless Connect to make sure we connect people into coordinated entry. This year, that's more important than ever as we leverage coordinated entry as the prioritization to come into shelter as emergency cold weather shelter turns on. Additionally, we want to get folks connected with service providers. To connect 400 to 450 people with service providers through our typical street outreach would be very different than having all those service providers in one place. The second most question I was asked yesterday after where's the cold weather gear was where are the housing providers? And we said upstairs. So that's good. That's very good to hear that question. And so I believe those housing providers were quite busy yesterday. And then the last thing is, we always have an eye toward life safety. So this is our annual event where we hand out new coats, snow pants, boots, hats, and gloves so that we can keep folks safe. A couple of interesting things that came out of Project Homeless Connect. Groups came from where they were staying together. We had a group of approximately 8 women who all came together from the shelter. Our Downtown Hope Center, we had groups from Davis Park coming out, and our partners with the Resource Center at Catholic Social Services were running a shelter. We think that being at the library was a really great location and really increased participation. I wanted to share, kind of moving into data, a document with you. This is a document we've been putting out. We've done it 1 month now. This is this current data. New data will be out in about a week, so it won't always align with when the committee is meeting. But I wanted to go over this format because this format is open to input. We want this to be usable. So right now there are 2,457 people experiencing homelessness. We break down the who and the where. So that number breaks down into 1,664 single adults, 284 unaccompanied youth that are up to age 24, and 509 people in families. And then where are they? There were 475 were unsheltered and 1,982 are in sheltered transitional housing. I think it's really important when we have a big number to talk about who and where those folks are. Big headline is Anchorage has the lowest number of people experiencing homelessness since January 2020. We're lower than pre-pandemic levels. And then what we do on this document is try to answer the most common questions we're hearing. And one came from the business community. How much is it costing us to move someone to housing with supports? And then why does it seem like there are a lot of people outside? That's a very common question. And so we try to answer that. We talk a little bit about what the primary drivers to exits the housing are. And then, of course, we hit some upcoming events or big things that we want to publicize. This is very much a reflection of what's on our data snapshot page with a little bit more information. This gets pushed out to our business partners, in particular, Downtown Partnership, Chamber, AEDC, who then push it out to their membership. We want it to be usable for you all, really. So it's something that can be a source of information for the public. And as I said, if there's something you want to see on it, that's relevant, you should ask because it's completely open beyond the big number, the who and the where.
Okay, I've got a couple questions for you. Thanks. Mr. Voland.
Thank you. I think this is really helpful. I will just say the headline, I've said things to that effect at community councils and they do not believe me. And I think sort of in that lower left-hand side, why does it seem like a lot of people are outside? I think that is really relevant to that question because I think people are still seeing a lot of visibly unsheltered folks. And so I think, in terms of feedback on this format, kind of driving that point home is important. I also wonder about, so the 475 unsheltered folks, how does that compare historically over time? Is there, could we see how that maybe wax and wanes? Because I'd like to take this information and give it to my constituents. Thanks.
On the unsheltered number, rate last October, the agreed upon community planning number was 900. So that's a defined point. So it's about half from where we were going into emergency cold weather last year.
Yeah. Go ahead.
When you guys are doing these counts, I guess, how hard is it to do? Do you feel like there's some folks who maybe are camping further out, or like what are the sort of hard parts of getting that data?
The hard parts of getting that data are inflow and outflow, right? Someone might be outside today and resolved tomorrow. Someone might be outside today and we didn't catch them. So we really look at that number on a monthly basis. So we're really taking kind of aggregate information. And you should know that number is everyone. So it's families we see outside, transitional aged youth, single adults. And so one of the things that's changed, and you'll probably hear it from Ms. Brown, is our planning number for emergency cold weather shelter. We originally said 450 was a good planning number. We reduced that down to 400 because you already fund emergency cold weather shelter for families and it's already on. It started October 1st. And so we hadn't broken that number down. That was our oversight. But you can then see proportionally kind of in the system where those numbers are coming from.
Great. Ms. Bronca.
Thank you, Chair. On the left-hand side, there are, I can see it, says something about local law limits encampments to 25 people. And we all know that Davis Park is far more than 25 people. And we also know that in Russian Jacks, there's far more than 25 encampments. So I just don't know where the disconnect is there between saying local law is limiting that and it's not on the east side, maybe not in other areas either. So that's one concern I have. And then when you look at the people that were getting gear yesterday, if did they all go through the intake process? And then so for instance, one person is up here for a job on the slope that I talked to, and she doesn't have a place because she's heading to the slope in a couple days. Do they get counted as part of the experiencing homelessness because technically they don't have a home right now? Or, I just kind of wonder how that works.
Yeah, that's a great question. We do see fluctuations with seasonal workers or people who are taking jobs outside of Anchorage. They do count as a person experiencing homelessness because they currently are, but then they will exit the system. They will exit it to either permanent housing because they have housing elsewhere. That's why our system serves approximately 11,000 people a year. And then we have kind of those who are currently experiencing homelessness, right? So we have people who will touch the system sometimes very shortly and then move on.
And then about the encampment number, probably that's more a question later on. Are you going to handle? Okay.
Great. Okay. And next I have Mr. Martinez on the phone.
Thank you, Chair. Just a couple questions. And I apologize for not seeing the information perhaps just provided. But it was mentioned that folks came in and had like anecdotally said, where are the housing providers? And I wonder about the same responsiveness for folks inquiring about employment. Do we track that at the Homeless Connect? And when and the coordinate entry upon entry, do we also track employment interest or some directionality of how to provide that support of employment?
So we collect through coordinated entry income. So whether or not someone has income, because it's not always through employment that income is generated. I did not have specific inquiries about jobs, but we did have a number of employment agencies upstairs, and we can reach out to them and see if they were keeping track of how many contacts they had. I believe 9 Star was there. Who else was there? Sorry.
The Division of Vocational Rehab was there. Goodwill was there. I think that might have been it for employment services, but we did have multiple employment services organizations there to help people with those applications or job search services like resume building and things like that.
Mr.
Thank
Martinez.
you. When folks come into coordinated entry, and we're tracking like those initial needs, is the employment track part of the initial intake of some degree of getting a sense of where people want to be?
Thank you. So there's an income conversation. It's not just collecting what is your income. It's, do you have income? Where is your income coming from? Are you interested in expanding your income? That's the conversation. And we do it around income because folks might be waiting for Social Security benefits or have other sources of money. And so it is all a part of a larger conversation.
Okay. The point that I was flagging is, I think that may be an important criteria that perhaps it explores different than income, as income, the idea behind employment, especially with respect to unhoused providers nationally, when folks engage in that work, it's really about purpose and kind of having a sense of purpose. And income in and of itself doesn't define purpose. It may define a different category of reliance. And so I just wanted to flag that. And then also, to the question of the effect that people see on the streets, do we have some degree of a timeline, the average amount of time it takes through the continuum to get from intake to a destination, so that we kind of have a sense of how long does it actually take when people come into the system to get to where they need to be, and then separating that from the revolving folks? Thank you.
So we can work and give you some data analysis around length of time homeless. So length of time homeless is one of those things we watch, but it's system-wide. We can take a look and see if we can break that down for unsheltered versus sheltered, but even that might be a little bit tricky because someone who's unsheltered today might be sheltered tomorrow and then unsheltered again. But let us dig in to give you accurate data that is based on certain parameters and be very transparent about what those parameters are. The last thing I want to mention on the income conversation, the reason we focus on income, it is a system performance measure from HUD as to how people's income is increasing, especially once housed. So that's why we have that conversation in that manner.
Thank you.
Okay. Looks like Ms. Bronco wants back in. Go ahead.
I appreciate that Member Martinez brought that up. We met with Omar Martinez from Houston Income Now, and it was very interesting. I know Yvonne from ACEH went to the meeting as well, but they have an overlay that Income Now is on their coordinated entry. Do they need childcare? What kind of jobs have they had in the past? And they have an expectation that once they're on the coordinated entry, they will be outreached within a certain number of days for employment possibilities. They have mobile caseworkers for employment. And I think it's really important. They were telling us that 32% of the Houston population that's unsheltered, it's due to lack of having employment. So if we could explore in some way overlaying that into the coordinated entry, I would appreciate it.
We'll pass it on to the coordinated entry committee. We do not set the coordinated entry parameters. That's through the advisory council. That is its own self-governance.
Doesn't look like I have any other. Do you have more you want to report on?
I just want to wrap up on your public-private partnership bullet. So I had the opportunity to say it yesterday when I spoke with the mayor, but Project Homeless Connect and our work with the municipality is a true public-private partnership. And it's not just a funding partnership. It is really the integrating and coordinating of services across Parks and Rec, APD, the health department, us, and then the providers. One of the things we've been able to establish in the past couple months is a street outreach weekly meeting where everyone who is coordinating around street outreach in particular is coming to the table. Your church group, the Hope team, us, community volunteers. So we're making sure we're braiding and leveraging our efforts in a way that makes sense, that we're also making sure if someone has a particular expertise that we can get them out to meet the person with the particular need. I think this is a really great opportunity for us as a community to making sure we're being strategic on both the public and private sides. So we'll keep you apprised of that as it continues to develop and move forward. But it's really allowing our street outreach access to be more pointed and sophisticated and strategic. We, of course, at the coalition are still trying to reach every reported encampment. So it's really great to have these additional resources if something pops up to be able to go out and assist. Thank you.
Great. I just have a couple of other questions before we close. I wanted to go back on the data entry piece of it. It seems pretty clear to me how inflows happen, how you're catching those through outreach or through Project Homeless Connect. And so that would be an inflow as a new person coming into the system. How are you tracking outflows? How do you know that someone has exited the system? And then what's typically the sort of time frame for when you would know when an inflow happens and an outflow happens?
Yep, great question. So inflow is, you've touched the system, you're recorded into a project. So whether that's street outreach or coordinated entry, or you've shown up at shelter and they're recording that you are now in that project. Outflows are a little bit trickier. Outflows are exits from projects. So if someone leaves shelter, they should be exited from leaving shelter. But sometimes the shelter provider doesn't know. Someone can walk out the front door and we may not know. Similarly with street outreach, we know if someone's housed and we'll exit them to housing or exit them into a different program if we know they went. So we have this inactive number that sits. So someone stays in our system for 90 days. Last touch. And after 90 days inactive, they're exited. And then we can watch that inactive number because we can watch returns from inactivity. So then we know we frankly lost track of them for potentially 90 days, or they resolved temporarily. Maybe they were couch surfing or doing something else and they've come back into the system. So we watch new to the system numbers and returns from inactive. So that tells us that differentiation about who's coming into the system. And then we have exits to permanent destinations and exits due to inactivity. Exits due to inactivity, though, are not necessarily a bad thing. If I am homeless today and I am experiencing homelessness today and I have, I'm able to self-resolve, but I haven't reached out or I just have self-resolved and moved on, I will exit in 90 days.
Okay, so the number we have, the number that you have at the top of this form includes people who are in that inactive space but have not been exited yet. But for instance, there may be a number of people that are in that 90 days you haven't heard from, but they're still counted in there until they time out of that 90 days.
Yep, and that asterisk about our annual data cleanup is some going back and making sure some of those exits have happened with programs where we know the exits should have happened. And
Okay.
you'll see that roll out over the next couple of additional data reports. It's an ongoing cleanup. So we suspect to see the number drop because we are accounting for a number of people who should have been exited.
Got it. Got it. Okay. And then my other question, it's more of a statement, I think, than a question, but it's just a continued challenge that I think we all face. And you had mentioned the coordinated entry as a separate entity. And I think that for just the average person like me, it's really hard to track the different entities and the different groups and the different efforts. And I think to the degree that we can work to try to create some way to show a map of this or to show and I know there's different variations of that, but I think it'd be really helpful. And then the other parts that you've heard me say before is all the plans, right? All the different plans that we have. And they're all so great. It's just really difficult to sort of track all of it. And so anyway, that's just an ongoing challenge that we have, but I just want to sort of put that on the record.
So Jessica and I talked about that on the way over here, actually. And we think it's really important to map the continuum of homelessness response services in our community. We are happy to partner in doing that, but someone somewhere needs to find a person to take the lead
Yeah.
to do that. And so we would be happy to participate, happy to leverage HMIS, but the issue is there are providers who aren't even in HMIS, right? And to be able to capture all of that. So we are happy to partner in that. We tend to agree. We do that though, the point in time count, we do reach out to those non-HMIS providers as well. So when we get that number, that is probably not of people, but of capacity. That is probably the most accurate snapshot, but ongoing, we wouldn't catch that new program necessarily until the following January.
Okay. Thank you. Thank you. Anything else from you guys? Okay. Thanks so much for being here. Appreciate it. Okay. Next up, we're going to have Farina. I think you're next up, and Thea, reporting on emergency cold weather shelter plan and year-round shelter. And then you probably want to stay up for the next part of it, where you go over the plan as well. Does that sound right? Okay. Well, welcome and introduce yourself for the record, and you can begin. Yeah, it's on the back right here. There you go. Yep.
Good morning, Farina Brown, Special Assistant to the Mayor on Homelessness and Health. I will first respond to Member Brunga's questions about abatement. We are continuing to abate camps. It is no secret that we are resource constrained, so we are consistently abating camps using kind of the prioritization list and really trying to ensure that we are engaging with campers in outreach activities to get them to move along, as well as any of the camps that are near schools or protected land uses. I want to acknowledge loud and clear, recognizing that Russian Jack and East Side have really taken a brunt from the last summer where we had larger camps and then people that felt comfortable returning to those areas. We have active law enforcement engagement, HOPE team, as well as routine cleanup from our Parks and Recs team. And just so that you know, we are not paying attention to those areas, but as we move closer to being able to stand up non-congregate shelter to ensure that we're able to direct people, that they have a place to go, we will start to engage with those larger camps. One thing that we heard and was identified by our coalition partners are people are interested in housing. People are looking for somewhere to go. So that gives us a lot of confidence about the number of individuals that will seek shelter and seek services. And we've spoken to this before during our last meeting here. What we really talked about having the rapid rehousing as a component to standing up our non-congregate, because we really want to ensure that we are creating flow in the system. And if there's not a place for people to go between shelter, congregate, or non-congregate, we are not going to see movement and we're not going to see change. We have included in our non-congregate and congregate contracts the need for case management and linkage, because we recognize that employment is going to be one of those key pieces to give people meaningful engagement, but an opportunity that they can sustain those apartments beyond the rapid rehousing period. So all of your feedback from community and assembly members are being listened to, and we are trying to embed those in all of our steps in our process between congregate, non-congregate, and rapid rehousing to really create the continuum of care and ensure that there are linkage to behavioral health providers, to social services. Member Martinez asked about the employment services. We, as being there with the mayor and engaging in Project Homelessness Connect, talking with all of the social service providers that were there, a component of what they do is not just connecting people to Medicaid services or Medicare, but it's also, are you interested in employment? So that is just an ongoing part of that conversation, because individuals are often, as the data demonstrates, that you reported 32% are homeless because they lack employment or they're underemployed. I don't have the data statistics for Alaska, but I would feel very confident in saying that that's going to be equally represented. And so a part of our behavioral health continuous convenings that we have initiated and that will be ongoing and are a part of our housing and homelessness strategy that will then move into care coordination groups that need to ensure that there are wraparound supports and linkage to whatever that person needs also includes employment. Okay. I will jump into the emergency cold weather update. We, as everyone is tracking, we have currently one bidder that will be moved forward on the October 22nd assembly. There's been a recommendation to award, and that will be in front of the body. We are actively engaging with a second bidder. We are in the confidential negotiation process. That is an absolute result of feedback from the assembly and the community to ensure that we have a diversity of vendors that can engage in our non-congregate space. We will also be moving forward the third-party oversight contract to onboard at the same time that we have non-congregate, so that we have quality oversight in ensuring that all of the concerns that have been reported regarding our non-congregate providers, that we have a level of engagement, oversight, and an ability to really create real-time solutioning and real-time communication back to the administration and our partners at AHD. We take very seriously all of the concerns, but we also want to ensure that it's documented and we have the ability to move forward through the administrative process if there is a need to cure with regardless of what vendor we see concerns with.
Actually, can you pause just for a second?
Sure.
Mr. Bolland has a question.
Yeah, thank you. So regarding the oversight piece, I think it's important. I do recall that last summer there seemed to be a lack of clarity around oversight's role and who they had oversight of, and there was some tension between the health department and the third party. And so I guess I'm just curious about the administration's direction on that. How do you see that third-party oversight being empowered? And is there a role for them to give feedback to the health department as well?
Thank you for the question, Member Volan. We heard that loud and clear, and we are going to have the third-party oversight contract will be through the municipal manager's office. So that allows for a collaborative opportunity between our non-congregate, congregate vendor, the administration, as well as the health department, that we all sit at the table together and listen, because our congregate and non-congregate contracts are operated through the health department. So they are a clear partner in all that we do, ensuring that we have empowered our third-party vendor to provide feedback that sometimes we may not always want to hear. It's just human nature, but how do we hear that respectfully and then move to create solutions in real time so that we are doing a better job with our own oversight and ensuring that if there's anything that we've put into the contract with our non-congregate or congregate providers, or that should have been in place in our policies and procedures, that we think about a way to operationalize that that's meaningful and demonstrates that quality of care for the individuals that we're there to serve, and that everyone has a voice, from the vendors that have to implement that, as well as the contracting body, which is AHD, as well as the administration in our partnership in this.
Great. And can I just ask a follow-up? Sorry if I already missed this. Do we have a third party ready to go, or this is something that's going to be put out there for proposal?
Sure. We did have an RFP for a third-party vendor, and we did not receive any bids. So we are moving forward with a sole source contract, and that will be put forward during the assembly meeting on October 22nd.
Okay, thank you.
Just a couple of quick follow-ups, just so I understand and I think this is what you were alluding to, the third party, some of the reporting was access to information. I think there was some of the challenges the last time. Will you be able to get sort of ongoing feedback during the period so that you'll be able to access some of that and make changes and shifts? So it's not an evaluation that only happens at the end. It's something that's ongoing and you're able to access the information throughout. Is that correct?
Absolutely. And thank you for the question. The team from AHD did a wonderful job with the RFP and identifying where there were gaps in communicating. And so we have taken much of what was in the original scope of work to move into the sole source contract, which includes weekly meetings with the vendor, as well as weekly meetings with our congregate and non-congregate providers. We will also establish an internal cadence so that all partners, the administration, AHD, and vendors are at the table. So we will have a plethora of communication opportunities.
Thanks very much. I don't think there's any other questions on that, so you can go
Okay.
ahead and go forward.
And I will turn it over to Thea.
Good morning, everyone. Thea Agnew-Benben, Special Assistant for the record. Is this, yeah, good.
Yeah, you're good.
We are sharing a revised version of the health and homelessness strategy with you this morning. We have some color copies. Do you want me to hand those out? Yep. The parts of this I want to emphasize first are the 4 3-year goals you see on the front page in the upper right-hand corner. First is to significantly reduce unsheltered homelessness through low barrier shelter and connections to housing. So I think that's a lot of the information that Farina was just sharing related to all of these kind of operational improvements to really increase that flow from unsheltered to sheltered to housing and supports. That's a huge emphasis of the work we're doing right now. And I think the data point that Member Martinez asked about in terms of length of time homeless, that's one data point we're also interested in. Another one is length of stay at the different points of the continuum. So we'll be, we actually already have added some of those to some of the reporting requirements for the contracts, and we'll be to managing those data points. Second one is increasing access to behavioral and physical health services. Farina mentioned we've been bringing behavioral health providers together. We've had 2 work groups. We're having another one in a couple of weeks. That's really going to take kind of the third step in this series, which is to operationalize the pathway that we've been designing together so that we have a really clear both kind of, we're creating kind of a graphic that actually has contacts and locations for the different points along that continuum. But also we're going to be kind of role playing that together and seeing how that works. So again, as we move into this cold weather season, that's something we'll be very closely monitoring, is that people are actually getting access to those services. The third one is, of course, adding new housing and increasing access to existing housing. This is really a team effort along with Graham, who's another special assistant in the mayor's office that's developing the mayor's housing strategy along with many of you. So we will be, our place in that will be to ensure that as we're developing housing overall in Anchorage, that there's a specific emphasis on households who are low income and what's also called very low income. We also will be making sure that there's allowances for alternative types of shelter as we're exploring different technologies and different types of potentially manufactured housing and other things, that some of those could be used for lower barrier, lower scale shelters that we'd like to explore over the winter. The fourth one is probably the most important. Can I just change this one?
Sounds fine.
Hopefully that's better. The fourth, better? Maybe not.
We can hear you fine.
You can hear, okay.
Yeah,
It just sounds real choppy right
Yeah.
here. The fourth one's probably the most important, which is to harness community partnerships, funding, and data to reduce the systemic contributors to homelessness. As Verena mentioned, we've been hearing a lot from the community. We've been engaging with community councils, engaging with assembly members. We really want to develop positive partnerships with all sorts of community groups, organized and unorganized, in order to really increase our just overall responsibility for addressing this issue in our community. As we know, the municipality can't do this alone. We also want to bring in additional funding sources, both from other private funders, but also from state and federal funding. So we're participating in the legislative priority setting. We'll also be actively seeking out grant funding. The mayor has included in the budget a new grants team, and we feel like that's a very important layer that the municipality has really missed for quite some time in terms of bringing in federal funding that supplements local sources. So those are some of the things that we'll be focused on there. If you go to the middle of this plan, you'll see we have 3 columns. The first is the first 100 days. We're happy to report, check marks. All that stuff's been done. 6 months, so this is through the end of the calendar year. These are the things we'll be focused on within our 4 goal areas. And you'll notice that the health, housing, and partnerships one spans across the 6 and 12-month period, because those are ones that are, just need to kind of have a steady focus on, and we won't have as many kind of incremental steps as we do with shelter. So you can see in the shelter 6-month and 12-month columns the different tasks that will be focused on over those periods. And then on the back, we have our summary of our actions and results. We're showing the plans that the strategy builds from, which really include Anchored Home, our Housing and Community Development Action Plan. That's the plan that AHD manages with the community, that directs the funding that we get for CDBG, home, and some other sources. That's one we'll be actively engaging with to think about how those funds can better support the community strategy. And then, of course, the roadmap for safety and well-being. That's the recently approved plan that helps direct the alcohol tax funds. And then we also have our contacts. There you go.
I don't see, yes, go ahead. Please, yeah, please.
Ladies and gentlemen, hey, I'm Lieutenant Fuchs. I'm the CAP team commander, HOPE commander. Just kind of wanted to give you an update on the HOPE team and CAP and some of the efforts. I think it's important you understand both sides here as we go forward. So the HOPE team is here today. They're in the back there, and they have engaged. They were at the Homeless Connect yesterday. We had a booth, or a corner, if you will. I think the corner is more relevant, but there was a lot of participation. They were, as you know, or maybe you don't know, Ruth and Tanya have been a team for about 7 years now in the mental health world as a co-response unit, and now as a HOPE team. And they were able to connect with a lot of past connections and clients and things of that nature. That was super important for them to continue those relationships. It was just an overall great event. I got to spend some time with them yesterday and just see a good turnout. So they are also partnering with the health department. There's some products that the health department through a grant have come into that we're going to be able to hand out to some members of the homeless community. They're kind of life safety type stuff. That we're super excited to partner with the health department to do. Again, being the kind of the kinetic piece of the city when it comes to this, that we're out there and we're able to connect with those folks where they are, and they don't have to come anywhere, which is pretty unique for most people. in most cities. So they're doing that stuff. And then I'm going to continue to stress the public safety piece that they provide when people are victims of criminal activity within the camps. There's a continuing build of relationships within those communities with our team to report crimes. And when crimes go unreported, then we can't find the perpetrators. When crimes go reported, we can then try to divert some resources to determine what that crime is, and then allocate resources to conduct an investigation and hopefully facilitate arrest to get some clarity and some closure to the victim in those situations, because we have a lot of victims in those camps. On the CAP team side, I think it's important that you understand kind of what we're doing on the CAP team, especially on some of the East Anchorage projects. So we have engaged and we will continue to engage with community members, community council teams. It's one of the things that the chief and I try to do is get out to the community council meetings and meet with those people and just kind of have a really good, sometimes constructive conversation. Sometimes we just get yelled at, and that's okay too, because I think people have a voice, and it's okay for us to take some of that heat. And sometimes we understand that. But the CAP team is out there. They've gone to Russian Jack, Willowa, Davis Park here recently, connected with some of those folks out there, connected with some of the members, some citizens that live in the area, specifically some citizens that had some very specific complaints about some of the things that were going on. That is an active concern of ours. And I think it's important that you know that we take those seriously, and I deploy resources as soon as I know that those things are out there, so that they can follow up and ensure that the community knows that we're out there and we're trying to do an investigation. We had some very specific concerns about a very specific crime in that area, and we looked at it yesterday, actually. And so if we can identify it as investigatory leads and we can go ahead and prosecute that, we will. And we will continue to do our job as a police force. So we are engaged in aspect of it. We are working with the city to find good strategic ways that we can go out and we can benefit both the sheltered and the unsheltered communities within Anchorage. So that's kind of what we've got going on. And I hope if you have any questions, I'll be happy to answer.
Yep, I've got a queue here. So I'm going to start with Ms. Bronga. Go ahead. Okay, great. Mr. Boland?
Okay, great. Appreciate the update on the Hope team. I think it's a really fantastic idea. You know, I think we all know that there are public safety issues in and around some of these camps for various reasons. And so to have y'all checking in regularly is a great idea. I am curious about the interplay of the Hope team versus the MIT, because to me, it seems like maybe the same personnel are functioning in both roles. If it's okay, so maybe we could kind of, because it's a big priority for the assembly. We want to have that MIT be able to go up to 24/7 operations and respond to those calls, de-escalation, et cetera. So maybe if you could speak to those.
Yeah, absolutely. Thank you for the question, sir. So, so Ruth and Tanya were the original MIT one. So they were basically the foundation for that program. They did it so well, I made them the foundation for Hope. So I've disconnected them from MIT in an operational sense. They both work and they coordinate directly. So all my units, there's a lot of mission creep on both sides, right? So a lot of what we do in my command is kind of intertwined, if you will. But the Hope team is not involved in going out and responding for calls for service for mental crises. I have 5 other officers and 5 other clinicians. I just hired 2 new additional clinicians that are onboarding currently and are working to get on the street. So we have 5 teams right now that are deployed to do the crisis response for the mental health component in the city, de-escalation, things of that nature, actually at the point of crisis, at the call for service.
Thank you. That's a very encouraging update. Oh, it looks like maybe Thea wants to respond.
I just want to clarify that the mobile crisis team is with the fire department.
Mobile
They're
intervention team, MIT.
MITs with ADD.
Yes, thank you.
MCTs, and they're the ones that the budgets to go to 24/7 is the mobile crisis team.
So if I could respond, Mr. Chair. So I think that may be where we are in terms of where the administration is heading in this next budget cycle. But as I understand it, it's been a priority for some time of our body to see both be able to go to 24/7 and have that fully integrated model. So both the MCT under the fire department and the mobile intervention team under the police department be operating at 24/7. Thank you.
Great. And I put myself in the queue, just a couple of questions to clarify. And I guess I want to go back on first of all, really appreciate this. Wonderful. And I particularly appreciate at the very end, this sort of the connection with all the different plans. And I think that, again, this effort to try to coordinate planning and to see the relationship between these plans. So just having pictures of the different plans right here is a really good first step. I also just wanted to say, as it relates to outreach, that I find the same challenge, right? I find the same challenge in lots of different outreach efforts, from ACEH, from the Hope team, from I think there's other organizations that are doing outreach. And I'm wondering, is there a coordinated outreach? Just like we're doing a coordinated entry in terms of data, we're trying to get all of the data into one system so that we can all be seeing the same things. I'm curious about that as well, because I think it's wonderful that we're increasing the amount of outreach. I think this is something that we've been missing for a long, long time. I think it's actually, if there is a silver bullet, beyond housing, it's outreach. It's actually getting to people and talking to them and learning about what's going on and getting them connected to things. So that's another question in terms of both the sort of coordinated planning, coordinated outreach, coordinated entry. The coordination seems to be a real theme. So that's something I think I'd really love to see us try to pursue more and more. If you'd like to speak to that,
Sure.
you
And I'll address that. And thank you for the question. That goes back to what our coalition partners talked about, the weekly street outreach meeting. That is something where we have the outreach partners that are all engaging in that space, connecting. And I failed to respond to your earlier question, which was directed to the coalition, but I wrote it down, is kind of creating that map of partners so that we all understand where they engage in the system. And that is something that we will step into in collaboration with the coalition to kind of create that map of the continuum, which will include outreach. We can also take back some of the feedback around outreach and look at, is there an opportunity for us to add this into our strategy so that we're consistently speaking to it, in addition to just kind of having maybe a standalone map that folks can point to. But all great questions. And I think the start of it is the coalition has already leaned into that with the weekly outreach meeting. And then we can just bring that forward more visibly in documenting who those partners are and just having something tangible to refer back to.
Sure, Thea.
Just to add to that too, there's outreach, there's also inreach. So part of what we're doing with our behavioral health work group, and that also includes a lot of providers that also provide physical health services, is that, for example, somebody might show up in an inpatient bed and they're experiencing homelessness. So what is the connection for that person into our continuum of services? So part of what Farina referred to, and I kind of forgot to talk about it, as one of the follow-ons from this behavioral health work group that we've been setting up, is we are going to be working first with our Muni partners, so with APD, AFD, and our coalition partners around care coordination. So when we have individuals who are very familiar faces, how can we really kind of circle all those folks and think together about what are the resources that maybe they don't know how to connect to, or bring that together. So we'll be doing that both at the kind of system level in terms of helping increase that coordination, working, like Farina said, with the coalition, but also at some of the individual levels for people who are very frequent users of our system.
Thanks. Just another just key point is as we're moving into the budget cycle, it sounds like that this coordination role is probably our role as a city. I mean, because I continue to hear from the coalition about trying to really differentiate themselves from, that's not what we do. We do this, they do that. And I think that that's going to continue to be a challenge if there's not an organization that is coordinating all of it. And that, it sounds like it's the city. And then the other piece is just in terms of what the long-term sustainability of some of these services are. and what is the city's job and what is a nonprofit or another organization's job in terms of this. So that's the piece I'm looking for long term, to if we continue to be a coordinating force, but thinking about who does what and how it's done. So any other, yes, Miss Bronga and then Mr. Volant.
So speaking of that, the who does what, yeah, I was digging through numbers of what we spent as a city through alcohol tax and municipal budget, and it's not sustainable to continue it. And I know that we have taken on a model through our 5-year plan to fix homelessness, but I'm hoping that you all have taken an opportunity to look at Downtown Hope Center and their model and rescue mission. They are high barrier, but they have pretty amazing success. And Hennings with their Reverb program for training in restaurant skills. I don't want to keep people who are on the high barrier end from the discussion, because they are also doing great things in our city.
Great.
I'll just make a comment that I am very familiar with those entities and very much appreciate what they've done. I believe that we've not done a very good job of acknowledging that prior to the municipality really kind of stepping and leaning into these spaces, that it has been our nonprofit providers that have done this work for many years at both low barrier to high barrier access, and they've done it with a level of excellence. And so I appreciate you saying that, and just want to acknowledge and recognize that we, especially Thea and I, because of our years and just working with this, recognize that, and we will do a better job of acknowledging it.
Thanks. Mr. Voland and then Mr. Constant.
Thank you, Mr. Chair. I just wanted to ditto your point about the central coordination and the role of the city. I think Thea will recall that was one of the recommendations of the Task Force on Complex Behavioral Health Needs, is that we would have a position in the health department to be sort of that central coordinator. And, in order to make sure there's not duplication of efforts, et cetera, and that everyone's talking to everyone. So certainly in line with prior recommendations. Thank you.
Thanks. Mr. Constant.
Yeah, thanks. I just want to speak to this idea of us not kind of utilizing or supporting the quote high barrier shelter providers. And I just want to say, from where I stand, it has very little to do with not supporting their work. It has to do with we don't invest in them if they won't follow our Title V civil rights protections. And so that's the bottom line for me. I just want to make sure that's plainly stated.
Thank you, Mr. Constant. Yes, Dean. There's a button on the back. There you go.
This on. Thank you, Mr. Chair. I appreciate hearing about APD's Hope Team and how it's recently launched. And I apologize if I missed it before in previous meetings, but we also have the CAP team that you mentioned. And it seems like many of the functions the Hope Team is undertaking were things the CAP team used to do. So, but probably more than what they used to do. But I was just curious if the Hope Team leaves some of the burdens or tasks that the CAP team covered, or are they still involved with campsite abatements, or what's the effect on the CAP team's, I guess, workload? And
Thank you, sir. Yeah, I can clarify that. Well, first of all, the workload is high and my personnel is low. So I would love to get more people on the CAP team. I just simply can't spare them. So there's a difference between Hope and CAP, and it's very, very defined in my mind. The CAP team is there to ensure that the safety and security of the campers and the abatement processes and the coordination between agencies within the municipality for the abatement process. And they're more of the enforcement aspect of what I have to do. The Hope team doesn't participate in abatements. They don't anticipate in any enforcement when it comes to those types of scenarios. Their main function is to do outreach. Their main function is to connect people with services and to partner with the coalition to ensure that these folks that are suffering from being unsheltered have the capability and then build relationships to expand their knowledge of what's available for them to break that cycle of homelessness. There's a dual role, public safety on both the CAP team and the HOPE team in crime prevention. So CAP team goes out and investigates crimes as appropriate, whether it's people being victimized within the campers being victimized, or if the campers are suspects in criminal activity, the CAP team can go out and do that investigation as well as patrol. And the HOPE team will then, through their relationship building, we're trying to get other people who are victims of crimes who maybe not be very comfortable talking to a regular street cop, will report to the HOPE team of a particular crime. And those are the two ways those entities kind of support each other, but are very different in their mission scope.
Thanks. Okay, do you have additional things you'd like to report on today? No. Okay, great. So we're gonna, and I don't know if you want to stay for the health department, but I think Kim, if you'd like to come up, we're gonna have an update specifically on the alcohol tax report. I think is the main thing that you're going to be reporting on, correct? Okay, great.
Thank you so much. Kimberly Rash, Anchorage Health Department. So I am going to take you on a journey in the past of 2023 alcohol tax and the funding that was spent last year. It is notated that this report is late. So in the future, the reports will be coming out by the end of the first quarter of every year. And so it'll give a more timely look at the year prior and the spend. Next slide. All right, so today we're going to talk about early education prevention, housing and homelessness. I'm going to go over some grantee feedback that the team received, our commitments, and then if there's any questions. All right, so overall in 2023, this slide shows you how much was awarded and how much was spent in totality. So a little over 21 million was awarded, and spent was a little over $17 million. And then the subsequent slides that I'll go over kind of breaks those down for everyone.
Just a clarification, when you say awarded, you're saying that we sent money to someone else. Someone else was awarded these funds, and this is how much they spent.
Awarded means someone received these funds, and then spent is how much they spent.
Okay, thank you.
Yep. All right, so first up is early education and prevention. And I know this slide is a little tiny, so my apologies, but we do have a lot of great grantees that received a lot of our funding. So under early education prevention, there was, on the left-hand side, you'll see all of the entities that were awarded and the amount. You will also see how much was spent of that amount. And I can go over that here in a second. The middle column here is what services were provided with those awarded funds, and then what impacts those made on our community in 2023. So during that time period of January 1st through December 31st. So the first one that you see here, and what I will do is I'll go through the ones and kind of just highlight a few from each category because there are a lot of slides here. So Awake was awarded $125,000. The services that they provided during the grant period was direct services for victims and survivors and legal advocacy. The impact that they made to our community is that they received 4,944 crisis calls, 5,866 clients were served, and 48 protective orders assisted by their legal advocate. The health department does receive some funding through our Women, Infants, and Children program. That amount was not fully spent out, and that was due to position vacancy. So that award, that as a grantee, we have a funded position, and that position was vacant for a couple of months in 2023. The services that we provide through alcohol tax with the WIC program is increased access to nutrition programs and submitted a Medicaid mailer. So 3,857 individuals received nutritional support. 685 participated in produce matching benefits. 3,857 individuals were assisted in enrolling in SNAP, that's Supplemental Nutrition Assistance Program. And then, again, I won't go through each one of these, but there was another entity that did not spend out all of their funds, which was the Anchorage School District. And they, like us, had some staffing issues as well. The rest of the entities on here, STAR, Victims for Justice, and Volunteers of America all spent out their total awards. Next slide. This right here is just the same exact information. It just puts it in a graph form so you can kind of see it a little bit clearer of what was awarded and what was spent. Next one is evidence-based grants. These funds were available to the grantees between the months of June and December of 2023. So these were a part of the first quarter budget revision process. And so some of these entities were able to spend out all of their funds and some were not. Again, on the left-hand side, you'll see the entities, you'll see the services that they were providing our community, and then the impacts that they made. So for example, the first one is the Alaska Adoption Services. They spent out their total award of $100,000, and they were providing a service of mobile diaper delivery. And so the impact that they made on our community was that they served 1,757 families. A little over 145,000 diapers were distributed to families in 2023. You will see that Anchorage Youth Court, Boys and Girls Club, Catholic Social Services, they did not spend out their full funds because they received the funds later in the year. As we know, that is an ongoing issue that we are addressing and we continually address is how quickly we can get those funds out into the community. Oftentimes it's really working with the partners, working with internally our partners, working with the grantees, working on their scopes of work, making sure that they have everything that they need in order to move forward, and then working with them if they have questions throughout the grant cycle. All right, next slide. Here are some more entities that received, again, evidence-based grants that were awarded through the first quarter budget revisions. So their time period was June through December of 2023. Left-hand side, entities, services provided, and then the impacts that they made. One of the things I will highlight here is Volunteers of America. They spent out their total award. The services that they were providing the community were family services and support for students in the summer. And so 52 youth completed a 3-week camp, 60 family members attended family night, and 7 youth attended a week-long camp. Next slide. Again, this is the same information. It's just in a chart format, so you can see what was awarded and what was spent. And then on the previous slides, you'll see why those amounts were not fully spent out in that time period. All right. Housing and homelessness.
You want to, Paul, you want to jump in before we get in?
Yeah, I guess I would just like, I appreciate that efforts are ongoing to address the timeliness of these grants going out. You know, we're kind of in the budget process right now, and I think what I'd like to know is, do we expect a better situation in, you know, as we look to appropriate these alcohol tax funds coming up? Do we expect that these grants will be more timely, or are there still going to be barriers? Can you just kind of give me a little hope there?
Yeah, for sure. So a lot of the grantees, their contracts, so last year we did put in that they do have option years. So that does make it a quicker process. And that is subject to appropriation. So that does have to occur in order for those option years to be activated. What occurs is when we have to go through that competitive process, that does take a while. And so oftentimes, if you think about it, an RFP and RFGP minimum has to be out on the street 2 weeks. Most of the time, we like to give at least 4 weeks. And then you have to go through the rest of that process with an evaluation committee, recommendation of awards. Additionally, if there are any sole source appropriations that are made, what we try to do is engage with those entities as soon as we know. So the sooner that we know that things are occurring, we can engage with those entities. But if it is closer to the end of the year, the beginning of the year, sometimes that does pose some difficulties and we can't get them out as quickly as possible. But overall, with the option years that we have, things should go a little smoother.
I'm not sure I'm fully familiar with that. Can you explain that concept to me? Option years?
Yeah, so there are grantees that receive funding for 1 year, and then subject to appropriation, we put in those option years so that they continue to run the program that they have been awarded. And so they can continue those efforts into the next year. Because with the alcohol tax, it does run from January to February. What isn't used typically does roll into fund balance. And so if there is an appropriation of funds to continue those services, then we can continue and activate that, an amendment to that contract.
Okay. So I guess, and the language has to be in the appropriation?
Yes.
Okay. So I guess I maybe would just flag that for the administration, that whatever is in the mayor's proposed budget, that where appropriate, hopefully that's in there. Those option years already specified. I don't think we've gone over that yet, but that would be interesting. I guess I want, as much flexibility as possible for these various organizations to be able to accomplish the work that we want to support them in doing. Thanks.
Yeah, and that's what we, that's what we had heard previously, and that's why we added those option years in 2023 for that.
Ms. Braga?
So doing some quick math, and I lost track of all that didn't get spent amount that, because we didn't have option years, is going away. Is that correct? So like, for instance, Boys and Girls Club, they had 120,000 unspent on there.
So for this was data from 2023. So anything that was not spent in
It's already been
2023 was put into it rolled over into 2024 fund
Gotcha.
balance.
So that's done and gone. Okay, because there's one organization on here that I think I will be doing a amendment to the spend, because they've been wiped from here. That it's incredibly important. So I just wondered if any of this money was available to make that whole again, but sounds like not.
Correct, because that time period is come and gone.
Mr. Constant, you have a question?
Mr. Rowland got to the point of the question I had.
Okay, thanks. Okay, you can continue.
All right. The next category is housing and homelessness. And so the left-hand side is what was granted, services provided is the middle column, and then the impacts that were made are on the right-hand side. Some of these, like the American Foundation for Suicide Prevention, almost spent out all of their funds. They had just they did not utilize all the time slots. And theirs was a TV and digital messaging campaign. And so there was over 1.7 million views, 938,000 listeners, 1.9 million views of the digital display ad, and 174 e-newsletter clicks. And so just going again through these, a lot of great services, a lot of huge impacts made to our community. Next slide. Again, more entities, everything from Brother Francis Shelter, Complex Care, Christian Health Associates, Emergency Shelter for Covenant House, Supportive and Essential Services for Covenant House. Most of these awards were totally spent out. There was a few that had some lower hotel rates, some challenges with the grant stipulated insurance. That is an area that we continue to work on internally, is those levels of insurance needed. And then just some accounting for one of the contracts that we had here. Next slide. All right. Some more. And it's 2 more pages more. And so there's more entities here. Again, everything from the Crisis Stabilization Center that Providence was still working on, which is going to be used for construction, was used for construction, and a portion of the remodel and renovation to expand access to behavioral health care for adults and adolescents. There is food on here. There is the contracts for oversight at the East 56th Avenue, at Alex Hotel, at the Sullivan Arena, all things that took place in 2023.
So I'm going to pause you. I think
Yeah.
well, I want to make sure that we have enough time to go through it, but I want to, is there another section after this one? Yes.
The only other section that we have is directly in regards to the Anchorage Health Department's funds and then grantee feedback. So I can kind of speed it up if you like.
Yeah, well, and I
Yeah.
think the main thing is because we'll have an opportunity to I think we'll get this on our website and we'll get it and we'll be able to dig through it and then maybe have more questions. But I think maybe just go a little higher level and just like the main things that we learned from this, the main things that you want to report out. Maybe that'd be a better way to move it forward.
Yeah, for
Thanks.
sure.
Sure.
All right, we can go to the next slide here. There was one on here, Recover Alaska, that was a direct grant. They totally spent out their award. This was one of the items that was provided to us by the body, and that was funding for MSW students. So 1.5 FTE faculty members were in the clinical behavioral health. And 99 students participated during that grant duration. So that was something new that occurred in 2023 that was really exciting. The next slide. This is direct costs with the Anchorage Health Department. So this handles all of our personnel and operating costs for grants and contracts, FTE, in fiscal, and then our housing and homelessness services. And so you can see that it was what was awarded to us was not fully spent out due to the vacancies that we had within the team. Next slide. This again just goes over all the charts of all the information. And then the most important is grantee feedback. So this is feedback that we received and that we just wanted to provide the body. So there, throughout 2023, the grantees had indicated that they also had staffing challenges in finding qualified help. They had high turnover, competitive wages was an issue to attract talent, access to childcare. Another thing was promoting the programs. They would like to see HD do more of their promotions on our social media pages, which is most certainly something that we can do. Transportation, there was some, they would like some more bus passes for some of these programs, the ability to have bus passes, and then improving housing for people with disabilities and improving outdoor play areas. Now, these are our commitments. Our housing and homelessness team is a team of 5 individuals, and these are our commitments that we are making to the community and to the body and to the administration. It's to continue to this transparency of alcohol tax spending for the community, provide more on-site visits and oversight of grantees and contractors, and increase collaboration with community partners, and really looking at that continuum and hearing the feedback of what space does municipality play versus the space that our nonprofits play. And so really just digging into that. And then any questions? And I know that it was a lot of information contained in here. You should expect to see this on an annual basis for the prior year of alcohol tax funding that is awarded and spent through the Anchorage Health Department. And if there are questions after reviewing all of this, please reach out. I'm more than happy to answer anything.
Yeah, It looks like one question, Ms. Ronga.
So I was thinking in my head because you've experienced community council meetings, but one of the biggest things is you're just taking our money and you're doing whatever you want with it. And we thought we were doing this with it. We thought there was going to be more drug treatment, more behavioral health. And I'm just batting this, and it's probably a bad idea to bat something without thinking it through. But is there any possibility that when you bought your six pack, you could earmark it, like, I want my part of the tax to go to behavioral health. I want my part of the tax to go to homeless response. In some way, then empowering local people to feel like they know the direction their alcohol tax is heading. And I imagine that's just an impossible thing to employ, but just came to my head.
I think just to address that question, I think part of the process to develop the roadmap for safety and well-being was to do a lot of community engagement so that people could share their priorities. And so all of the strategies that are shared in there are prioritized by the level of community support that was voiced for them. And then if you go to the back of that document, we have a pretty clear summary of like specifically what people shared. And then we also did a survey that's tabulated there as well. So I think would be administratively, I imagine, and also legislatively challenging to have people kind of put a token into a bucket for each of the three things, 4 uses every time they, were charged a tax. But I think the intent of doing a plan, and many of you engaged in that, many community members engaged in that, is to provide that direction both to the assembly and to the administration so that we're following that direction as we allocate those funds.
Sure, go ahead.
I just had this really shocking moment when one member, when we were putting forward this roadmap to success, said, well, that's all good, but any given Tuesday, we do what we want. And that is, to me, unacceptable, that this is a community fund. So I'm glad we have a plan. I hope we can all work to follow it.
And just a final comment for me on this one is I'm looking forward to the alignment of this with this, and I think that the presentation shows it in the 3 buckets, but what it doesn't do yet is show how it's addressing each one of these priorities and how because I think the report. The message I get from the report is we did a lot of things. We funded a lot of organizations. We didn't spend as much as we were hoping to spend. I don't know how much we accomplished. I don't know how much and I know there's a lot of outputs. We're not seeing outcomes yet, obviously, and how each one of those fit into a priority of the community. And so I think that's our challenge moving forward is to create a way of reporting it out so it's clearly showing these are the things that we're trying to accomplish, and this is the result of the investment. So.
Just to add one quick thing, and actually to get more to your question, Member Brangas. So in 2023, we were kind of thinking of 3 designated uses. You'll see in the roadmap, it's really kind of 4 because we split 3 into homelessness and behavioral health because they're kind of lumped together before. So for example, like in the following year when the allocations are reported out, like in what you just saw, Providence's Crisis Stabilization Center, I think was lumped into homelessness, but in this newer way of thinking about it, that would certainly be a behavioral health spend, which is what it was. So, and then I think the other thing the roadmap does is it does provide some, not just output measures, but also outcome measures that we can start looking at as a community and seeing the impact of not just the alcohol tax funds, but hopefully also how it leverages other money to achieve that overall plan.
Thanks. I have Mr. Constant. He has a question.
Yeah, thanks. It's two parts. First, Yeah, and I don't ask this with any judgment in mind. Maybe I missed it. Are you presenting on behalf of the mayor or Agnew Beck?
I'm no longer an employee of Agnew Beck, so I'm a special assistant to the mayor now.
All right. I just recognize that this contract was through that company. So, okay, thank you. And then I wanted to respond to you, Ms. Braga. I think there's an old saying in elected office that heavy is the head that wears the crown. And that applies not just to the mayor, but each of us as legislators. And the fact of the matter is that you are the person the people in your district hired to fight for the allocations you believe, as is every other member of the body. And thus, when 7 of us join around a proposition, that is the will of the people. And so, to my perspective, it can be every other Tuesday that allocations be made to meet needs, or we could just do government by computer.
Is that it, Mr. Constant? Okay,
Yeah, that's it.
great. Thank you. All right, Mr. Voland, and then I think we're going to move into audience participation. I want to make sure people have time. So go ahead.
Yeah, thank you. So both in the working group for the alcohol tax strategic plan and in our discussion, I think we did try to clarify that the assembly is not bound to this document. This document is policy guidance for the policymakers, but does not preclude us exploring other uses for the alcohol tax, other appropriations. And again, just, that kind of asserts our role as the legislative body that's responsible for appropriations. So I too hope that we will continue to be guided by this plan, but I realize it is not the be all end all. Thank you.
Thanks. Anything else you'd like to share before we close?
Nope, thank you.
Thank you for all the information. Thank you all for being here. Really appreciate it. Can I just see a show of hands of who would like to speak for audience participation? I want to make sure we have enough time. I see 1, 2, 3. Okay, I think we might be able. We may have to extend a little bit. Okay, great. Maybe 4. I see. Okay, great. And we have a microphone right over here. Wonderful. Okay, so we have plenty of time, so nobody has to rush. But if you'd like to begin, yep, come on up. Right up here in this chair right here. And if you could state your name, you can go ahead and have a seat. State your name for the record and where you live in Anchorage, and you'll have 3 minutes. And there's a timer right up here behind me, so you can see your time. Yeah. And yeah, push it.
Keep it.
There you go. Oh, one more time. Just push the button one time. There you go.
Got it.
Got
Okay. Thank you. All right. So I just had a couple questions regarding the mayor's health and homeless strategy. One of them, reading through the document here, is that I had a question about the identification and launching of warming sites for November through February. And are you guys going to be sending out an RFP, or are you guys going to be, and who's responsible for that? Secondarily, I guess I could ask that first.
Yeah, and we typically don't respond to questions in public testimony, but
Oh,
we'll write them down.
That's kind of where I was at.
Okay, so and then I think you can actually connect with somebody after, or you can email us with the questions.
Farina
but-
or?
Yeah.
Thea.
Yeah.
Okay.
Yeah.
Yeah, I was up here for actual questions.
Oh, yeah, so this
and
is
if-
usually
and
how it
if I'm
works.
out of
You
order,
just-
then I
you
apologize.
have 3 minutes to sort of speak, but if you have specific questions, you can catch us after, and we can answer your questions.
Okay, yeah.
Okay.
I think still say the questions so they can be captured.
Yeah, yeah.
Okay, that sounds
We would
fine.
definitely like
Oh,
to hear.
so my questions that, just so you have it out there, that you might want to address to somebody. So my question was that identifying what the November through February and how and when that RFP, or if it's going to be some other way, is going to be put out there. And then I was also looking at the identification of opportunities for the day shelter and innovative spaces, which means out of the box, in my mind, out of the box type thinking concepts for folks. and which would be maybe housing and warming and food, those types of opportunities. And that kind of revolves around me in a sense that I am more valuable currently in the community, I believe, and I've been helpful on a, if I was to broad stroke it, for quite a few years in the beginning of the first, I think, 150 people on a pretty small scale, but of homelessness. So I think I'm more valuable on helping health and wellness rather than on the alcohol tax side of the business. And that's where my flavor is at today, and kind of where my heart is at. So having said that, without getting any deeper into this, I'm gonna let somebody move on so I don't take up time.
Thanks. Thanks very much for your testimony. Okay, who'd like to come up next? Go ahead and have a seat. Your name for the record, where you live in Anchorage, and you'll have 3 minutes.
My name is Ronald Ava, 50-year resident of Alaska. I live in Rogers Park. I also have businesses in Fairview. I'm represented by all of you. I'm here to clarify some of the many emails that I've sent to you. And the first issue I'd like to address is my first college course was a book I had to read, How to Lie with Statistics. And the flowering reports about how homelessness is decreasing, I don't believe that at all. I think it goes unreported, just like crime. There's no sense reporting a crime because you fear retaliation. It creates a negative number in your real estate district that it's a high crime neighborhood. And I want to object to using any minority profiling in the statistics of the homeless because it adds to racism. If you say a certain percent, 43% of the homeless are of this nationality or ethnic background, that begins labeling them. And that's totally wrong. And I think that's obviously supporting racism rather than preventing it. And also, I don't like the flowery accolades to Catholic social services as doing their job, because they're not good neighbors. They're not good performers. They're under a conditional use to pick up garbage within 25 feet of their facilities. Ask them to show you a form on their good neighbor policy. Ask them to show you their reports on picking up garbage, and you will end up with nothing. So don't give them accolades and don't give them any money. That's shameful. Then the crisis intervention team or the HOPE team, you can't holler at police when they show up. If they show up, they're there to help you. But also, they shouldn't be just directed to the camps and the homeless. There are victims, such as myself, witnessing 3 sexual assaults in 4 days. I still have to testify at a trial for a rape case that every time I think of it, just sends me backwards as a human being from what I witnessed. So these are negative triggers. I think you should address them. I have more. Please read my emails and answer them. This is not going to end well for me. And if this keeps up with dismissing 1,000 cases because you don't have prosecutors, there's a law in Alaska, the Alaska Instant Justice Law, and that's going to turn very violent, especially with the guns on the street. I know my 3 minutes is up, but I'm open to any questions.
I don't see any questions. Thank you for being here
Okay.
today. Appreciate it.
Thank you very much.
Yep.
These two are doing a good job. They did answer me.
Right. Okay, next up, please. Come on up. You could state your name for the record and where you live in Anchorage. You have 3 minutes.
Hello, my name is Miss Sophia O'Neill, and I am a resident of Eagle River. So how did we get here? For example, it is too often overlooked how people obtain identification, file taxes, claim residence, apply for assistance, and the PFD. When one aspect in the chain of acquisition is marred, fraud begins. Shortcuts are taken through unethical, easier means regarding what is required. Example, listing a residence, any residence, when not on a lease. Criminals use the lack of housing, desperation, to lure the vulnerable to commit criminal acts in the guise of helping them. This includes fake job offers and fake apartment listings. Criminals and unethical service providers convince, coerce, and use the system in place now to commit fraud. Criminals create victims by finding them and indenturing them, telling victors where to list as their residence, living there or not. The victim becomes indentured, using that address to also apply for food card, to get the PFD, and filing for tax returns. The expectation in return is the victim must give a percentage or all obtained using a need against them on the "I know what you did" mentioned as a means to coerce. And then the duped and penniless are on the street, often thrown out of the residence when the criminal gets what they want, keeping the snap cards, ID, etc. So help wasn't help, it was a means to an end for them. The difficult to house, like a recent arrival for work, jail releases are high targets. Criminals by word or sight waiting to see people released or who appear vulnerable or alone. Another problem, real estate owners allowing multiples to reside in a residence without insisting on limits or all people being on a lease. This act allows the actual leasee to claim the PFD and multiple people's PFD and other allowances for allowing their address to be used. Yeah, sure, list my address and now give me a percentage or even all. And because of the lack of oversight, this can continue indefinitely. With some owners of properties, as long as they're paid, they'll turn a blind eye. But don't you forget reputable landlords that have a terrible time enforcing tenant occupancy, upkeep, or removal. The out-of-control rights of the abusive tenant is not kept in check either. There's a long time needed that out-of-state owners and renters be better regulated for the sake of all the future of Alaska. Long before promised new housing is built, the underregulated oversight and the lack of housing provides a considerable lucrative venue for the extensive criminal ventures and a continuation of victims, helping to create the tent cities you despise so much. Thank you.
Thank you for your testimony. I think we have one more. Any objections to extending for 3 more minutes? Seeing none, go ahead and come on up. State your name for the record, where you live, and you'll have 3 minutes, sir.
Hello, Jamie Lopez, East Anchorage. Probably won't be a master class today. A little under the weather. John Hoffer from Ruth Adolph to go ahead and meet. Can't do it, guys. Law enforcement, you're supposed to be separate from outreach, and outreach is about stability and lifting people up. Law enforcement, they have law enforcement objectives. I know you guys are still pushing the HOPE team, but a lot of people out there, they just do not trust the law enforcement when you got real nice ladies going out during the day and then you got the enforcers going out at night. And so it's human intelligence type stuff. They just don't trust it. At least most people outside. So at Davis Park, temperature was removed on October 1st, and it has not been put back there. Last year, what I saw play out at Cuddy Park was they stopped picking up trash along the back wall. They stopped driving in to pick up trash at the end of September. It seemed like it was a strategic goal to allow the trash to accumulate so that then you can have an October surprise in April to drive people to the polls. Maybe I'm right, maybe I'm wrong, I don't know. But yeah, the dumpster was removed, tried to speak to somebody about it. It has not been replaced. And you have a very, very large unsheltered population there. Tried to see if trash bags can be brought out to the people there because there are responsible people that will pick up after irresponsible people there. Another thing, so, ultimately the goal is to bring stability to people that are unsheltered, get them housing, try to assess what their issues are, and get them in a better state to reintegrate back into society. And so you put people into apartments, you do hopefully have competent case management, people that care, and typically they're paying for their rent for a year, they're paying for their utilities. Well, with that said, so there was a gentleman 2 weeks ago, a little over 2 weeks ago, September 25th, at the Mountain View Community Council meeting, who spoke up after I made similar comments about, law enforcement and outreach. It's not a good thing. And he talked about being harassed outside at 3 a.m. walking his dogs. And then 2 weeks later, what you had was CAP team showed up, and the 4 cruisers not last Friday. Was it? Yeah, no, it was last Friday, about 1:30 p.m. and literally went and arrested the guy for siphoning power from a street lamp. Misdemeanor charge. The costs involved to send the police out just to deal with this guy seemed a bit ridiculous. And so this gets into the larger discussion about keeping people alive long enough to get housing. There are hundreds and hundreds and hundreds of people outside, and something needs to keep them alive. I was paying to do it last year, and I've been trying to get a meeting for the better part of the past 90 days with the administration to talk about this objective. You have data sampling, and I'd like to know what the sampling methodology is. Well, actually, I know. Anyways, the main thing is HMIS data. That only pulls in what you get from the providers. It does not get you what's in the middle of the camps, because half the time they're not going into it. So you have CWS non-congregate. Last year you had, emergency cold weather shelter with over 1,000 people on that list. They decided we cannot abate Cuddy, we cannot abate Davis, because there are way too many people outside, not including the rest of the camps. I could go on for a very, very long period of time. But there are volumes and chapters. My time is up. And so if you want to talk, I'm willing to talk. And yeah, I'll leave it at that. All right. Thank you very much.
Thanks. Thanks for your testimony. I didn't check to see if there's anyone on the phone. Travis, is there anyone on the phone? No. Okay. Thank you everyone for being here today. Appreciate your time. This meeting is adjourned.